became clear, even though I was I think a very good clinician, the folks I was seeing just weren't, there were so many challenges that they were facing that I thought I got to think outside the box.
Yeah, I always say, when I talk to students, I always say, your job is to listen. The people in the community are the ones with all the expertise. Your job is to figure out how do you help them based on what you're hearing. How do we, bring that piece of it to them, that people are more than just the health issues that they bring to you.
One of my favorite experiences was Rickie's a wonderful facilitator of focus groups. And I would tag along and we would talk to men with this one particular project around prostate cancer and hypertension. We would hear all about it. And part of my role then was there to answer their medical questions, because at the end of the day, these guys had no idea what hypertension was, prostate cancer, who was at risk, and I was able to explain that all as a clinician. And I think that complemented the qualitative work that we were doing with some clinical work, but it wasn't in the office, it was outside the office.
I think our skill set complemented each other, to be honest. It's like Jim taught me how do you communicate on the clinical side, and how do you do that? What are the rules? Kind of how's it all work? And I had more of the public health side, and being out in the community more. So I think our skill set really complemented each other.
From a health systems point of view, I think the community health needs assessment really stepped up the system's understanding of what the community was and who we were serving and what we needed to do in a variety of both sort of medical ways, but also in social determinants ways. I think the healthcare financing system has been changing dramatically to reward folks who address social determinants of health and actually have solutions to food insecurity or health literacy or housing.
So I think that was somewhat eye-opening and began that whole movement, as Jim said, towards thinking about social determinants of health and understanding that in terms of a holistic approach to why there might be health disparities besides the fact that you don't take your medicine.
And I don't like Facebook, but there's several that just have gone from the streets to shelters to substance abuse training, are now leaders in their community, and just having helped some folks along the way to reach their full potential has been, I feel very good about that.
I just feel so fortunate that I've been able to do this, that that I wake up in the morning and there's something new to learn, and I hope over time that I've helped make a difference. But I just feel like, thank you, Jefferson and Mainline Health, for even letting me do this kind of work, and for the people that I've had the opportunity to work with for making it all happen, for being there, for caring as much as I did.
I would also just like to end with acknowledging how rewarding it's been working with PACDC leadership and staff, and helping us see ways that we could advance our agendas and work together to make a better Philadelphia.
And for their leadership in so many different areas, and I think that's what made me realize the importance of working with others, being able to reach other people through other organizations that had credibility and were trusted in the community. And I think PACDC, their leadership in the community health needs assessment over all these years, has really been a great bridge and leadership into, I think, raising awareness of everybody, how important this is.